There's an expression that you read frequently on certain products that are in the kitchen or in the household. FDA approved for indirect food contact. Well, for us, in the cabinet building industry, it comes up with glues. Are the adhesives we use approved for indirect food contact? What happens, for instance, on a cutting board like this one, when you decide to cut up some vegetables or some meat or chicken or fish on this breadboard, and there is a hairline here where it will come in contact with the glue for a short amount of time. It ain't coming in contact with very much glue, because that is an incredibly thin line. I'm thinking, well, that's direct food contact. So is it approved for direct food contact? So we really want to know, what does the Food and Drug Administration mean when they say approved for indirect food contact? Now really what they're talking about is indirect food additive. It gets into the food by accident. When they're talking about direct food contact, that means a manufacturer is putting this in your food, like a food coloring. They directly add the product to the food. Indirect food additive is when you're sliding your steak across a cutting board and stuff gets into your food in that way. That's indirect food additive. That's what the Federal Food and Drug Administration means about approved for indirect food contact. Stuff could get into your food, maybe through packaging or the manufacturing process. So here's a case. If you're going to make a cutting board, what glue should you use to make it? To start with, let's take Titebond original wood glue out of the picture. For one thing, because a cutting board and a breadboard might get wet and you're going to wash it and clean it, it's exposed to some moisture. And the other thing is, it doesn't specifically say on original Titebond that it's approved for indirect food contact. So we can take this one out of the picture when it comes to having indirect food contact and go directly to Titebond 2 and Titebond 3. So based on the science that's available, and the FDA is never positively sure because things change, based on the science that's available, these two products, Titebond 2 and Titebond 3, are approved for indirect food contact, or whatever contact that your food will have is not going to be harmful to you. Now, someone will say it's generally recognized as safe, like a Ziploc bag, and you put food in there, and it's generally recognized as safe, but that's not your decision to make, according to the Food and Drug Administration. The recognized as safe is a decision they'll make for you, and so we have to rely on the Food and Drug Administration to decide if this is generally recognized as safe. But they have decided that you can put your food on here and you're not going to be exposed to dangerous amounts of anything that might come from the glue. They have an amount of exposure you could have in parts per million and parts per billion. They have recognized this as safe in this way. So what do we think about indirect food contact? The manufacturer is saying in their literature that these two glues are recognized by the Food and Drug Administration as approved for indirect food contact. So it can be used that way. And when they say it's approved for indirect food contact, in brackets right after it, they also say cutting boards. So in general, I don't think we have to worry. If we glue up with Titebond 2 or Titebond 3, it's food safe and it's going to stay together because we have a waterproof glue and we have a water resistant glue. Both of those will work real good on gluing up a cutting board like that. So maybe that throws a little light on what does it mean to be FDA approved for indirect food contact.